Good evening, committee members. My name is Emilio Ramirez, Director of Housing for the City of Oxnard. I'm before you today to discuss the Housing Authority's role in homeless services. In 1937, Congress enacted the Housing Act and started to offer housing assistance in their stated effort to provide safe and sanitary housing. In so doing, the United States started to offer public housing opportunities. During this congressional discussion, the Housing Act, the public objective was to remediate slum, blight, and homelessness, as discussed as motivating factors for the Housing Act. Soon after that, the housing policies in the United States changed in order to reflect the changing needs of the population, including the Housing Act of 49, Civil Rights Act of 65, and finally the Housing and Community Development Act, which itself created the Section 8 program, or the Housing Choice Voucher program. During this period of transition, the United States Housing Authority became the independent cabinet department of Housing and Urban Development. The Housing Choice Voucher program had been born, and it is now the federal government's major program for assisting very low-income families, the elderly, the disabled, in an effort to afford decent, safe, and sanitary housing on the private market. Since housing assistance is provided on behalf of the family or the individual, participants are able to find their own housing, including single-family homes, townhomes, and apartments on that open market, and that choice is key to the change in the original direction, which was public housing. Housing choice vouchers are now administered by local public housing authorities who receive federal funds from the Department of Housing and Urban Development to administer both the public housing program and the housing choice voucher program. Since the beginning of the housing policy, the Department of Housing and Urban Development has been very responsive to the changing needs, including the very clear shifts from public housing to the housing choice voucher program because of the demonstrated need to deconcentrate poverty and offering fair housing choices to impoverished households. HUD has recognized the need to provide decent, safe, and sanitary dwellings for homeless persons. In fact, in 2008, recognizing the high incidence of homeless amongst veterans, the Department of Housing and Urban Development partnered with the Veteran Affairs to create the VASH program. And that VASH program is intended to provide targeted assistance to veteran families. Other similar initiatives have been launched in response to other identified needs, including providing assistance to a family unit that is in need of unification, potentially displaced because of homelessness. Also, mainstream vouchers and emergency housing vouchers that are in direct response to a homeless need. Section 8 regulations expressly state that a public housing authority may adopt a preference for admission of single persons who are 62 years of age or older, or displaced, or homeless, or persons with disabilities over other than the single persons. That is expressly stated in the regulations. HUD also published a guidance on housing individuals from families experiencing homelessness. And that guidance is sought to offer housing authorities an ability to be responsive to the needs of homelessness. As I mentioned, the housing authority is expressly authorized to create a preference, and the HUD has a page on their website that seeks to train housing authorities on how to create a preference. It's really about creating a preference. But coincidentally, that training chose homelessness as the example for that preference. And they indicate that while a preference is permitted to be created, they offer an example that says that PHAs may give a preference to a family who is homeless or living in substandard housing, paying more than 50% of their income, and voluntarily displaced. Families who qualify for any such local preference move ahead of the families on the list who do not qualify for that preference. They're very clear about the ability to create that preference, and they're using homelessness as an example. Most recently, the current HUD Secretary, Marcia Fudge, declared that housing is a human right and pledged that she is ready to fight against homelessness. As I mentioned, HUD has created several special program vouchers intended to offer housing to qualifying subpopulations. In this case, the HUD partnered with the VA to offer a new kind of voucher called VASH, or Veterans Affairs Supportive Housing. The VASH voucher specifically targets housing assistance to homeless veterans and offers companion supportive services. The Oxnard Housing Authority did apply and has a current allocation of 77 of those vouchers, and we have used 36 of them. This allocation of VASH vouchers does not impact the otherwise established allocation of standard Section 8 vouchers or that standard Section 8 budget. Additionally, mainstream vouchers were created by HUD to assist non-elderly persons with a disability and with a disability who is either homeless or exiting an institution. They indicate that the disability could very well be chronically homeless. Oxnard Housing Authority, it has an allocation of 40 mainstream vouchers and has used 13 of them. We are currently working to project base the balance of those mainstream vouchers to a local development called Casa Aliento. The allocation of mainstream vouchers, again, does not impact the otherwise established allocation of standard Section 8 vouchers or of that Section 8 budget. Through the American Rescue Plan Act, emergency housing vouchers were created. Emergency housing vouchers are specifically targeted for homeless applicants. They require a partnership with the local continuum of care. It's an indication of HUD's recognition of a need in the community and responding to that, in this case, homelessness. The Oxnard Housing Authority has an allocation of 46 of these emergency housing vouchers and has used 16 of them. The allocation, again, does not impact the otherwise established allocation of Section 8 vouchers. Family Unitation Program offers a targeted response to the need for stable housing, allowing an otherwise fragmented household to unify as a single family unit. They offer the opportunity to regain custody of a child potentially lost due to homelessness. Additionally, they offer housing assistance to youth in the foster care or exiting the foster care system to homelessness or at risk of homelessness. The Oxnard Housing Authority does have an allocation of 10 of these FUP vouchers and has used 7. So I reference all of this just to demonstrate that HUD intently uses the voucher program offering assistance to otherwise homeless persons in recognition of the changing needs of the population in the United States. That practice of responding to homelessness by public housing authorities is also well established. There is a study in 2000, a publication in 2013 that was published by the Council of Large Public Housing Authorities entitled Housing Authorities, Essential Partners in an Ending Homelessness. And the director of that Large Public Housing Authorities Council stated that the largest and most forward-thinking housing authorities in the country committed to an effort to reshape the way that the housing system works with other systems, as evidenced by their local effort to work on homelessness. Many public housing authorities have created special programs, staff efforts in response to their housing authority, including the San Diego Housing Authority that is featured on screen now. The Oxnard Housing Authority has also been engaged in responding to the housing needs of homeless persons, including an allocation of those VASH vouchers in 2010. And we received our first allocation at that time and have been partnering with the VA to offer housing assistance to those homeless veterans. Currently have 75 of the vouchers, and they are being leased now. So staff is seeking support to generally be involved in the provision of housing services to otherwise homeless persons. Staff proposes to continue to work to use existing special purpose and population vouchers to seek new vouchers when they are available for any special subpopulation. Staff has submitted a request to HUD for approval to project-based mainstream and VASH vouchers to 2 local developments that are seeking to provide new opportunities to homeless persons for mainstream and VASH. This be Casa Lindo and Neding Road. With your direction, staff will draft and present a strategy for responding to homelessness, potentially including housing navigation, intake eligibility support, case management, training of homeless service providers, adoption of a local preference, project-based vouchers, in addition to the ones that we already are seeking, matter and engagement. So staff recommends that the committee receive this report on public housing authorities' response to homelessness and housing insecurities, and direct staff to prepare and present to the Board of Commissioners a comprehensive proposal to respond to the housing crisis and homeless needs. Thank you. I'm happy to answer any questions.